Hey everybody, Scott Salen here for HypnoThoughts Live. I'm speed dating, and that means that I'm taking a few minutes to talk with each of our pre and post conference workshop presenters just to get to know them so that you can make the right decision on which workshop topic and instructor is best for you. I'm here today with a person who's talking about a topic at HypnoThoughts Live that has applied to me personally in my life, that I love this topic. I think it is a great application of hypnosis and hypnotherapy that can just absolutely change lives. And that is hypnosis for childbirth and all the things related to that. So I am here with Nathalie F. Nathalie, how are you?
I'm good. Hi.
Hi.
Thank you for having me.
Of course. So let's just jump right into this. What are you bringing to HypnoThoughts Live this year?
It's my first year as a speaker. I was there last year, got COVID, didn't care for it.
Sorry about that.
That's fine. You bring a lot of things home when you go to a convention. So I have a friend who passed away, unfortunately. His name is Brian, and he said, if you're going to attend a convention, always ask to be a speaker. It's a different form of learning. And every time I just go right before going on stage, I always say, damn you, Brian. So I want to give back at your prices, it's really giving.
Yes.
So, and I have a different experience. I'm a family doctor. I delivered 3,700 babies over a 25-year period. So I was there when they were giving birth with hypnosis. It's not just like the practice in the office. So, and I could correct, and that's why I feel my program is so strong, is because I saw what they were missing, because I used to refer them to, we're not going to mention hypnobirthing, but we will. And sure enough, they were giving birth more calmly, but they were not in hypnosis. They were not in trance. And I shocked one of my patients saying, you did beautifully, but you are not in hypnosis. And she was like, what? And then I ended up doing sessions after my regular office hours. I ended up doing sessions with my patients. But you know how we do a deepening, and I was tired at the end of the day, and I'm a mother of four. So I had 4 kids waiting for me at home.
Right.
So I would do a deepening, going 7, going deeper down. And then, you do the pause, the biggest deepening of them all. And then I'm like, oh, I don't remember what number I'm at because I'm so tired. So I was like 5. And then when I emerged, my patient, she would go, I was so deep, I did not hear the number 6. So I had to find a solution. So my solution was to create a program. It was like a pregnancy. It took me 9 months to put it all down. And it's a step-by-step process, because many of the people that jumped on the program were doulas, because I have a lot of friends that are doulas.
Sure, that makes sense.
They were accompanying women at the hospital or birthing centers, and they were calming them down, but they were seeing how much they suffered. And, there's techniques in hypnosis where you can take away the pain and just have the joy. So they were the first one to sign up. And then I had so many, like, again, I was weekends certifying people, a group of 10, 20 at a time. So I certified master instructors that would teach the instructors, because, I felt like I had done my thing with the program, but it's never ending. There's a demand for it, that's for sure.
There really is. For me, just briefly, my experience was when my wife was giving birth to our son, I had never hypnotized my wife ever, and we just had this policy, let's not have me hypnotize my wife. We made that deal on our first date. When she learned I was a hypnotist, she was like, let's make a deal. You don't hypnotize me. And I said, great. And I never did until the day my son was born, because the epidural didn't take. And so the anesthesiologist gave her the epidural, and she felt her feet. And he said, well, I guess you're just one of those unlucky people that the epidural doesn't work for. I've been an anesthesiologist for 25 years. I did this right. Good luck having a baby the old natural way. And in that moment, I switched from just the, overwhelmed, crazy husband. All of a sudden, I sort of snapped, because I've done so much clinical work, in medical and dental offices. I said, wait a minute, this is my time to shine. So I jumped in, and
rapid inductions.
Did a quick induction, got my wife into the state that we needed her to be in, and she gave birth to our son completely pain-free, and was happy and relaxed, and was present. And so I watched it in my life, and I've had a couple of my friends have the same experience
Bravo for
where,
you.
and they've hired, like you said, people, maybe even the ones you've trained, where, whether it's a doula or, something like that. And just the ability to have that experience be non-traumatic. I mean, that's what you are going to give to these students, is their ability to bring that to their world. So as you're doing that, and you said we won't talk about hypnobirthing, but it gets mentioned. There are great programs out there, and without and I know you wouldn't put them down, but what do you do that makes yours different?
Well,
What's special that took 9 months?
Actually, I took all the hypnosis for childbirth programs. I've researched. I'm OCD a little, but that's a good thing. And I took the hypnobirthing certification with Mary Mangan. And there was a gynecologist in the room, me, and about 6 other people. And
you're
then
OBGYN?
No, I'm a family doctor that delivered babies. It confuses people. Then they go, "Oh, you're a midwife." No, I'm a family doctor. But 100% of my practice was obstetrics and following the babies afterwards. So anyways, she started the training, and she says, "Doctor or this, doctor or that. When you go to the hospital, they say a contraction, it's a bad word, it's a no-no word, it's a wave." So you're kind of working against, and if you get to the hospital, the nurse is going to welcome you saying, "How far apart are your contractions? How many contractions do you have? Did you time your contract?" She's going to say the word contractions. And honestly, my arm, I don't have much bicep, but that's a contraction right there. It's not a bad word. And trying to change people and fight, you don't have that energy if you're giving birth. You want to be in your bubble and positive energy. So that approach of saying, "Oh no, you're saying it wrong, and we're going to tell you, don't say contractions, say waves," you're not going to, it's easier to put slippers on than try to cushion the entire surface of the earth. Okay. So it was too much energy wasted in arguing with the staff, and you're a team. When you get to the hospital, you work with the hospital staff and you trust them, hopefully. If not, change place, go to a birthing center. I'm not a proponent of home births because 95% of the time it will go well, but the 5% of the time when it crashes, if you're far from a hospital, that could make a difference on the baby's outcome. So my friend doulas and midwives were always saying, "Why don't you do home births, Natalie? You're always like on your," I was like really the weird, more midwife than doctor, because I was on my hands and feet and, crying with my patients and doing hypnosis. I'm already like a weird one. But home births was where I drew the line, because those cases where it would have turned sour would have been like too much for me. So getting back to the program, you work with the staff, you work with the hospital, and you're a team, and then everything is positive. And it was so much welcome at my hospital. When my patients were giving birth with hypnosis, people would tiptoe in the room just to see, and they know how a woman giving birth without epidural is screaming and everything. And they would check that. Like, I posted a video of one of my patients looking at her baby coming out, and she wants to grab it and everything. So it's really, they're in the moment. So it's really fun. You're giving that to expecting couples.
Yeah, and to simultaneously give to an expecting couple the relief that that it's not going to be a traumatic experience, because there's like 6 months of you're going to these classes or you're doing all these stuff, and they're being trained, and everyone's saying, "Oh, get ready for the childbirth." And if you can give that couple, just the peace of mind, it makes the entire pregnancy more relaxing. And then obviously the birth of their child gets to be a beautiful, calm moment. It's such a valuable, amazing gift.
And the bonding too, like you don't have like the cesarean where everybody touches your baby except you. So there's no like first bonding right there. But I'm not against cesarean. Like, I had the lifetime 10% cesarean rate. Right now it's 33% in the US. So 1 baby out of 3 is born surgically. That's a lot.
That's a lot.
Unfortunately, the need for us, hypnosis for childbirth, has increased. If you look at forums, people are freaking out. There are always emergency cesarean. There's not that many emergency. There's just drama over drama. And then babies ended up at the NICU because they're being induced at 36, 37 weeks. The baby's not ready. So I never had a baby in the NICU in 25 years. And now when
Wow.
I spy on forums, all the babies are in NICUs because they're being induced for no reason. And the baby's not ready. You're an incubator. So, you know, it's
Right.
9 months. It's not 8.5. It's not 8. So there's so much need for reality and positive about birth. So yeah.
And like you said, the working with the treatment team. I did a lot of work in dental offices, and there were people who wanted to push against, if a dentist uses the wrong word or anything like that. We don't need to retrain these people that have, protocols that they went to college for a long time for. Like, we can just be part of a team and be a specialist and a subspecialist that allows everybody to do their job more effectively and have a much better experience. I think
But
this is, go ahead.
I don't want to blame the staff, but they have slips. Like if they come with a needle and they say, this is going to hurt, you're already
Right.
in pain.
Of
Okay.
course.
So that in the program, we address that. We're going to say, if you hear that it's going to hurt, or some of my patients came in the hospital and they do a birthing plan. They gave their birthing plan. And the nurse said, that, scuffed, like even my niece took my program recently. And the nurse scuffed saying, oh, you'll be begging for the epidural when you'll be 6 centimeters. And
Right.
it's kind of sabotaging, but that's the way they were brought up. They did not see like natural childbirth that went well. But
Right.
my niece, and they're trained in the program to reject those and really reject it with the hand like this. And
Sure.
then they have beautiful birth. You don't fight. You don't say, oh, you're wrong. But
Right.
there's a lot of how should I subconscious words, but we bring them to the conscious, saying if they tell you this, you can reject it. I was giving a conference and I was reading a book about pregnancy, and some books, they want to tell you everything that can happen to you and they're anxiety creating.
Right.
And it was talking about the baby's movement, which is the most beautiful thing for me. That's actually the only thing I enjoy about pregnancy, is feeling the baby moving inside of me.
Sure.
And they called it violent attacks. Can you believe it?
Whoa.
So subliminally, I closed the book and put it down. I said, now you know. And that's what the program also is like, pointing out those negative messages. And there's so much right now, like what sells in the news is always the drama.
Yeah, of
But
course.
it doesn't have to be dramatic, it has to be beautiful. And then there's a bonding that my patients have with their babies that's so beautiful.
It's such a great topic. It's such a great thing. And obviously to
Yeah.
have somebody like you who has all this experience in the world in this space, I mean, just an expert, it's a great class. So to those of you
Yes.
who are watching, if you have any questions or anything like that, we've made this real simple. You go to htlive.net. We have a button there for pre and post conference workshops. You look at this schedule, you can see everything there. And this is obviously one of the classes. You can click on it. You can see, a bio, a description, and register all in one place. We want to make sure that everybody who comes to HypnoThoughts Live gets the workshops and the specialties that they're looking for, so that when they come home, they can help even more people in even more ways. So Nathalie, thank you for taking time out of your
Thank
busy
you.
schedule. And
As you can see, it's going to be a day filled, because I'm passionate about it and I could go on and on and on.
it's going to be awesome. So everybody, you want to take this class. I mean, it's such a great market. It's such a great way to help people.
And it's such a great price too. I'm not going to do it ever at that price again.
The price you've given, it's such a discount. Guys, if you've ever considered taking this, this is the most affordable price imaginable for this content. It's an insane deal. Don't waste this opportunity. And again, Nathalie, thanks for being here, and we'll talk soon.
Thank you so much.